Filler migration is a hot topic on social media now. And in my practice, I've found that patients who may benefit from filler are now afraid or do not want to do filler because of this fear of filler migration. So let's talk about what filler migration is, why it happens, and how to avoid it. I'm Dr. Nina Desai, a board-certified dermatologist and mom of 4. My goal is to help you with your skincare concerns and share a little bit about my life. So don't forget to subscribe so you don't miss a video. So first, let's talk about what are fillers. So for the purpose of this video, I'm going to focus on hyaluronic acid-based fillers. But if you'd like to know more about other fillers, such as Sculptra and Radiesse, please comment below and I'll make a video about those as well. So the brands that you may have commonly heard about are Juvederm, Restylane, RHA, and Belotero. So what are hyaluronic acid fillers? Hyaluronic acid fillers are fillers that we use to volumize in areas where there's volume loss. As we age, our body loses collagen and elastin, the structural proteins that give our skin its bounce and its health. We have bony changes, so there's temporal wasting, periorbital wasting, and even jawline wasting that causes the skin to kind of fold forward, which leads to nasolabial folds, marionette lines, and jowling occurring. So these are common areas that we will put hyaluronic acid fillers in to help volumize and restore that youthful look to the face. Within each line of fillers, there are different subcategories, and those are based on how thick the filler is and how much stickiness that filler has, or how much G' and viscosity that filler has. And it is really important to pick the right filler for the right location to get the best results. So if I'm trying to restore some mid-cheek volume loss that tends to occur as we age and causes things to fall forward, I really want to make sure I'm picking a robust filler like Juvederm Voluma or RHA4 to help give that tissue more lift. And that filler is going to be placed really deep on the bone. But if I'm trying to volumize an area where there's a lot of movement, such as the lips, I'm going to pick a lighter filler such as Juvederm Ultra, RHA2, or a Juvederm Volbella. So now that you know what hyaluronic acid fillers are and how we use them, let's talk about filler migration. So filler migration typically occurs when filler moves out of the area that you want it to be in to a surrounding area. And there are several reasons why this can happen. The first, filler is not injected into the correct plane. As I mentioned, we use fillers to work on different areas of the anatomy, and it's very important to inject filler into the right plane to give you the right look. If filler is injected too superficially or in the wrong plane, it will not sit properly and it may migrate. Along with that, if too much filler is injected too quickly, it will go out into the surrounding areas. A common area where we see this happen is in the lips and under the eyes. It's very important to inject at the correct depth, to inject slowly, and of course to inject the right filler. Now, if we pick the wrong filler for a certain location, you also have the possibility of that filler to migrate. So one point I'd like to stress is while filler migration is a hot topic and it's talked about a lot on social media, it is a very rare complication. This does not happen that often. And I really want individuals to understand that filler migration, while there is a small percentage of individuals that can develop an inflammatory response, most of the time, it depends on your provider. So if you are going to someone who's well experienced and knows how to inject, what to inject, and where to inject, you should not have to worry about filler migration. So let's talk about how to fix this. So the good thing about hyaluronic acid fillers is they can be dissolved. There is an enzyme called hyaluronidase, which will break down hyaluronic acid fillers. And that is something that we as providers have in our office and have the ability to dissolve these fillers. While when we inject hyaluronidase, there will be a little bit of swelling, the results of dissolving the filler happen quite quickly. You can see the improvement in the area within about a week. So at home, oftentimes it's really hard for someone to tell if their filler has migrated. If you're concerned about this, I urge you to go see your board-certified plastic surgeon or your board-certified dermatologist so they can help identify if this is actually true filler migration or if there is another issue going on. But true filler migration, usually you can feel the product and it will look asymmetrical from the other side. So if filler needs to be dissolved for any reason, I typically will have my clients wait a full month before we start to re-inject certain areas. And that's just to make sure all the swelling and inflammation has calmed down, and we are now going in and re-injecting in an area where we're not worried about there still being old product left behind. And when it comes to how frequently you should have an area injected, every location is different. So the deeper fillers that are placed onto the bone can last individuals 2 years, sometimes even longer. But in an area where there's a lot of movement, like around the lips, those are the areas that you may find that you need to have done every year. Have you ever had to dissolve filler? Share your experience in the comments below. Don't forget to give this video a thumbs up and subscribe to my channel for more skincare and beauty videos.